Thank you very much. I'm Mohamed Mousa from South Carolina University, and this slide demonstrates part of our experience in collaboration with the computer science department at Hyogo University in Japan. This is a paper titled Benchmarking Vision Language Models for Brain Cancer Diagnosis Using Multi-Sequence MRI Data, and I'm presenting these slides on behalf of Professor Assam Rashad, the Professor of Computer Science at Hyogo University in Japan, and Professor Mohamed Shatouri, Professor of Radiology at South Carolina University. First of all, oncology patients navigating complex treatment journeys, the detailed and precise radiology reports are indispensable for optimal healthcare delivery. This necessitates places and a significant demand on radiologists to maintain accuracy, comprehensiveness in their evaluation. Furthermore, the increased incidence worldwide for the brain masses necessitate development of easy and reliable diagnosis methods that help the radiologist to achieve the best quality of reports for the increased number of these patients. Large language models, that known as LLMs, have demonstrated substantial potentials in generating and interpreting radiology reports. They can assist in diagnostic accuracy, classification, differential diagnosis, and structural reporting, thereby enhancing the efficiency and effectiveness of radiological practice. The use of large language models in healthcare has been no exceptions, from models that are designed for mental health support to those specialized in analyzing medical images more accurately, that can be known as visual language models or VLMs. These models can generate general descriptions for different images and generate reports that help in the process of diagnosis. In our study, we aimed at benchmarking various visual language models that are known as VLMs for generating brain MRI reports, and to evaluate the different model performance and to highlight the potential clinical applications and limitations. We used in our study an online database that contained 40 patients, which contain MRI scans for adult patients with histopathologically proven and confirmed WHO grade 4 astrocytoma. Each case includes 5 different MRI sequences, T1, T2 flare, T1 with contrast, and EDC values. These images were sliced into 2D axial images and arranged into a single composite montage image. This montage includes 5 different sequences, the previously mentioned T1, T2 flare, and EDC, with segmentation mask included at the list row as demonstrated in this image. This is an example for montage image. The purpose of this arrangement is to allow the visual language model, or VLM, to view the relevant sequences in a unified image, enabling more comprehensive understanding of the patient condition. The montage image, first of all, the montage image were fed into ChatGPT 4.0 with a structure prompt that guides the model to act as a professional radiologist to generate a detailed diagnostic report. Then, the generated report was reviewed by 2 radiologists who refined this report and this report acts as the gold standard or reference report for comparison with the reports that will be generated by the tested different VLMs. Once the expert reviewed the reports were finalized. The same prompt template that we have used with ChatGPT 4.0 was provided to the tested VLMs to generate the reports. These AI-generated reports were then compared to the expert-approved versions. To evaluate the quality of the generated reports by the tested VLMs, we used 2 state-of-art reasoning models were used, OpenAI, that's known as ChatGPT, and DeepSeek R1. These models judged the report based on several criteria, including accuracy, completeness, conciseness, and how these images are described. This diagram summarizes what we have said. First of all, the images were categorized and arranged into this montage image. The montage image were entered into ChatGPT to create a primary report. The primary report was rephrased by an expert radiologist to create the gold standard report. Then the same prompt we used with ChatGPT, we used with the tested VLMs to create the tested report, and we compared the gold standard report and the tested report in the terms we have mentioned before. We tested 14 top-performing VLMs, were selected based on the recent benchmarks. All these models are vision capable that can transform images and videos into text. These VLMs are categorized into small, medium, and large for fair comparison. The same prompt template and identical hyperparameters were used in all VLMs for consistency. Our study emphasized that the larger models are not always better because they require more computational power that need more specs for the used PC. We focused on the finding and best performing models within each size category. And here are the different VLMs we have tested. We tested 14 VLM as we have previously mentioned. We tested 3 large models and 4 small models and 7 medium-sized models. The evaluation process included 3 steps. The first step included several metrics that depend on the static evaluation. We compared between the models, the main text of the models, and we will describe it later. Then we used 2 reasoning LLMs, that ChatGPT and DeepSeek, for comparison regarding the previously we have mentioned parameters, conciseness, correctness, and accuracy of described images. And finally, the human evaluation, we compared by 2 radiologists the reports that we have generated from the tested VLMs and the reference reports. The first static evaluation depends on several metrics. These metrics are some sort of metrics that designed by several programming models such as Python. These metrics rely on the presence of same words or same sentences. As we see here, the first 3 models that are the large-sized models, the performance that measured by some metrics that called rouge and cosine, the similarity score, they similarly matched to the general evaluation by ChatGPT and DeepSeek. However, some small-sized models demonstrated high rouge and cosine values, but this was a false data because they generated empty reports or generated only the template we have provided to them without adding any descriptions. So these metrics we have used that just compare the words or sentences exact presence in each report are not accurate. So we have used the second 2 evaluation methods, that reasoning judgment by LLMs and human evaluation. These metrics depend on logic thinking, not just text similarity. Here are the different parameters: correctness, conciseness, completeness. The comparison of ChatGPT, DeepSeek, and the human evaluation averaged over the dataset. Each represent the mean of score from 0 to 10. The bold one indicates the top score. The underlined one indicates the rank score within each size of the VLMs. And these graphs summarizing the overall accuracy of different tested VLMs based on the based on ChatGPT and based on DeepSeek and based on the radiological judgment. The overall score, as shown in these figures, that shows the larger model size does not always guarantee the better performance. The Multivision 90 outperformed the QW72, but the trade-off was an additional of more than 20 billion parameters that require more than 20% computational power for the MetaVision 90. The MetaVision 11 is the 4th model in this list with only 20 billion parameters. Rivaling models such as DeepSeek 27, which is more than 2.5 times in the size. Also, LM07, the only medical specialized VLM in the list, struggled with poor performance as it shows, and was surpassed by QW07, which is a general model for the same size. To enrich the comparison, we employed an inference technique to evaluate the model's performance within the inference conditions. In this approach, we split the image. We split the image into 2 parts. The first part contained EDC and FLAIR alongside the segmentation mask. The second part included T1, T2 with contrast, and T2 sequences alongside the segmentation mask also. This allowed model to focus more effectively on the brain slices, providing better zoomed-in view and the images, and enabled the improvement of recognition of brain image details. Additionally, these models were exposed to these images through multiple steps or multiple inference requests. The model was asked to generate an initial report based on the first batch of the images during the request. In the subsequent request, the model was presented with additional sequences with the same slice or remaining multi-sequences, allowing them to refine the initial report that he had generated in the first step. This approach enabled the model to improve the general radiology report progressively rather than processing the data simultaneously as was done in the previous experiment. For subsequent requests, the model was structured to refine the previously generated report based on the newly presented images. And here is a comparison between two medium-sized visual language models, the DeepSeek 27 and MetaVision 11 models. The scores are in percentage. These results, as shown in this table, indicate the performance of DeepSeek and MetaVision 11 remains very close. The newly adopted technique in this comparison enabled these models to achieve results around 65, which is comparable to the large sized model that we have previously described in the previous figure in the previous slides. Here is an example for AI-generated report for this case. Here's an example for AI-generated report. In conclusion, the vision language models were significantly in size, design, and training data, impacting its performance. The top performing model in the large models, the most accurate performing model with large size is MetaVision 3.2. The medium-sized visual language models, the results of MetaVision and DeepSeek were comparable. Small-sized models showed low accuracy with 23.8, which is a poor performance. Iterative inference and the stepwise approach improved the medium-sized model to be comparable to the larger ones. Bigger models are not giving the better results. Smaller can be optimized to be more efficient and accurate. Thank you for your time, and any questions?
Thank you, Dr. Mohamed. I'm sure a lot of you have a lot of questions, and not everything is that straightforward, but if you can help us just go back before the conclusion, the slide where there is the report generated by the AI. Can you read it for us?
The MRI image show a well-defined hyperintense lesion in the right frontal lobe. The T1 weighted image reveal an irregular mass with a heterogeneous signal intensity. The T1 contrast weighted images further enhancing the margins of the lesion. The FLAIR images reveal large hyperintense lesion with a significant amount of edema, which is typical for glioblastoma. The segmentation mask confirmed the presence of an irregular mass in the right frontal lobe.
Okay, I have a comment about typical for glioblastoma, but we will leave it for the discussion.
It's AI-generated, not the reference report. ده التقرير اللي طلع من الموديل نفسه.
Yes, yes, and then you as a neuroradiologist, then you modify as
we can modify it. هو ممكن اشرح سريعا. هي اللي حصل ان احنا في الاول جبنا كان في داتا بيز موجوده فيها 40 عيان، احنا اخذنا الداتا بتاعت ال 40 عيان دول في الاول عشان نسرع الدنيا، اخذنا الصور بتاعتها حولناها لباتشز، الباتش الواحده فيها كل سلايس فيها السيكونس بتاعتها تحت بعض، وبعدين دخلناها على التشات جي بي تي. تشات جي بي تي كتب تقرير برايمري، وبعدين بعد كده احنا عملنا له ريفايننج، وهو ده بقى التقرير الريفرنس. في عندنا بقى تانيين 14 فيجوال لانجويج موديل، هم دول اللي احنا عملنا لهم التست. فده الريبورت ده طالع من واحد من ال 14 موديل، مش من اللي احنا عملنا له ريفايننج. تمام، وقارنا بقى التست الريبورت اللي اتعمل له ريفايننج بالريبورت دوت، وطلع بقى نسب الاكيورسي اللي احنا شايفينها. نسب الاكيورسي احنا بنتكلم في 65 و70% لحد دلوقتي يعني. ف بالنسبه لللارج موديل، الميديوم سايزد موديلز اللي هي حجمها اصغر شويه، اللي بتحتاج كومبيوتيشنال باور اقل شويه من الحاجات اللارج، مديه 55 56. بس لما اتعمل لهم ستيب وايز ابروتش، ان احنا لما قسمنا مثلا الفحص وبقى ادينا له 2 سيكونسز، وبعدين قلنا له اكتب برايمري ريبورت لدوت، وبعدين بعد كده ادينا له 2 سيكونسز اللي بعدهم، قلنا له عدل التقرير بتاعك بناء على السيكونسز ديت، ده حسن الاكيورسي بتاعت الميديوم سايزد وبقت قريبه شويه لللارج سايزد موديلز. عشان اللارج سايزد موديلز ديت مش كل الاجهزه بتعرف تشغلها، مش هتبقى الاجهزه بتاعتها الكمبيوتيشنال باور بتاعتها افيلبل في كل الاماكن يعني. بس فهو برضو احنا ما بنتكلمش في 100% لحد دلوقتي، احنا بنتكلم في 65 70% بالحاجات ديت.
65 70 كومبير
65 70 بالنسبه للحاجات اللارج. بالنسبه للمودريت، بالنسبه للميديوم سايز،
ده كومبيرد للاكسبر نيور راديولوجي، يعني الكومباريزون ده بتعمل
ده كومبيرد للريبورت اللي احنا عملناه، اللي هو المفروض ان هو الريفرنس بتاعنا، اللي هو كان اتعمل بشات جي بي تي واتعمل له ريفايننج بقى بالراديولوجيست.
طيب اوكي. So not to keep on schedule, I'm sure we will have more questions at the end of the session. Thank you very much.
Thank you.
دكتور رشاد.